everyone, I am Divya. I am the CEO and co-founder of Pinky Promise, where you can instantly connect with a gynecologist and get a judgment-free and highly convenient consultation. I am joined today by Dr. Reema Shah, the medical director of Pinky Promise, who is going to come and answer all of your questions on a very, very important topic of sex ed. जो हम सबको पता है कि हमारे स्कूल में हुआ नहीं था. So we're just waiting for Dr. Reema to join us, and once she does, we will start it. So give us 2 minutes, and Dr. Reema is just joining in. So let's start the process of asking Dr. Reema questions about all that you may want to learn about sex ed, जो शायद आपने स्कूल में नहीं सीखा होगा और गूगल करने में आपको शायद गलत information आ रहा होगा. So let's start the process. Dr. Reema, I think let's just start the conversation. I think maybe I'd love to understand from you, right? Like as a gynecologist, you've seen thousands of patients in your career, and abhi Pinky Promise mein all over India, you're seeing a lot of patients. So what are some of the most common concerns that people face when it comes to like lack of awareness or sex ed?
Right. I think the most common question I have faced, Divya, is confusion about whether their sexual activity can lead to a pregnancy or not. So I think a lot of people have confusions about, having is fingering, causing them to get pregnant, what time of the month, pull out method, is it safe, couple of those things. So I would just like to quickly explain that a pregnancy usually happens when the ovum meets the sperm, and the ovulation, if your periods are regular, happens right in the middle of your cycle, and that fertile window is between day 8 to 18 if you have a 28 to 30 day cycle. This is the maximum period when you can actually get pregnant. That does not mean that you will not get pregnant like any other day earlier. But if you have had intercourse on the first few days of your period or just before your period is going to come, there are very low chances of pregnancy. Having said that, it is still very, very important to use contraception if you're using a barrier method like a condom, or if you're having a contraceptive pill. An eye pill is not really the most safest. The emergency contraceptive is not the best method of contraception. It may not be reliable. It has a high dose of hormone and cause a lot of side effects. So using contraception is extremely important. Apart from that, if there is not complete penetration, if the semen has not entered the vagina, if intercourse is happening on like during your period or before or just after your period, there are very, very low chances of pregnancy. So that is one of the most common things that I encounter during our consultations, Divya, is the worry about pregnancy, whether the act has led to a pregnancy or not. And you can easily do blood tests. Even if you haven't got your period or just missed your period, you can book a test online. Yes, quick sample of beta HCG will reveal to you if the pregnancy is there or not. So most people end up stressing, worrying about that too much. So that is one of the most common ones.
Yeah, I think the most common concern is मैंने ऐसे किया क्या मैं pregnant हो सकती हूँ, मैंने वैसे किया क्या मैं pregnant हो सकती हूँ, and people really lose their sleep over it. I guess the most important thing that Dr. Reema is actually telling you guys is, number one, it's not all days of the month कि आप pregnant हो सकते हो. There are certain specific days जहाँ पे आपकी ovulation होती है, and जब आपकी ovulation होती है, if there is a sperm there, that is when you get pregnant. And it's not like just because somebody's done fingering, whatever, there will be sperm present, right? You have to actually have an insertion and ejaculation for that to happen. But at the same time, it's not like हमें risk लेना चाहिए. So it's very important to actually use the right method of contraception. And IPL is not contraception. It's not, it's emergency contraception. It is afterwards, right? But I think, Dr. Reema, आपने एक बहुत important topic के बारे में बात किया, which is this whole IPL situation, right? I think हमने इतने सारे cases देखे हैं जहाँ पे लोग 4-4 IPL, 5-5 IPL ले लेते हैं. People are constantly taking IPL या IPL को अपने primary birth control method जैसे use करते हैं. Is there any advice you would like to give all the young women जो सुन रहे हैं? Okay, many of the people have taken IPLs. It
Right.
can be useful, but
Yes.
it can also be abused, right?
Right.
So, what is the advice that you have for women? मतलब क्या उनको क्या सोचना चाहिए,
Correct.
कैसे सोचना चाहिए प्रोटेक्शन के बारे
So
में?
IPIL is basically an emergency contraceptive. Like if your condom has broken, or if you've missed your regular contraceptive during that cycle, or if there was like an unplanned, emergency, like once in 6 months, something like that, is when you are okay to use an IPIL when you had no other option. But to rely on the emergency contraceptive as a normal method of contraception is highly harmful to the health, because IPIL contains levonorgestrel, a larger dose of it, which can cause trouble in your hormonal balance, affect your period cycle. It can cause bleeding, spotting immediately. It can cause delayed periods. Multiple such pills in the same cycle can wreak complete havoc on your uterine lining, on your ovulation, on your hormonal balance. So it is very much recommended that you do not rely on the emergency contraceptive. You do not take the emergency contraceptive as a regular contraceptive, but use it only as an emergency contraceptive. And the
Yeah,
other
yeah.
methods of contraception are, there are many pills now available. We have a nice new non-steroidal contraceptive, which used to be available as Saheli, now available as Chaya or Sevista. It's Centroman. It's just a once a week tablet. Initially, for the first 3 months, you need to take it twice a week, and then just once a week. And it's like almost no side effects. It's non-steroidal. It just delays your ovulation, makes your uterine lining out of sync, and hence prevents a pregnancy. Very easily reversible too. After stopping the pill, there are almost no effects after it, and you can very easily try for a pregnancy immediately after that.
Got it. So basically IPIL जो है या unwanted 72
Yes.
जो लोग इसको बहुत frequently लेते हैं, that is actually something that has to be taken only as an emergency.
Correct.
मतलब आपके पास बाकी family planning methods या contraceptive methods होने चाहिए. Like you have
Right.
either used a condom, or you have used a normal pill, or you
Right.
have used other methods of contraception and वो fail हो गया.
Correct.
Or this has been an unexpected event of
Right.
intercourse, which is the
Absolutely.
only time that you should actually take IPIL unwanted semi-dose. लेकिन बार बार जो लोग
Yeah.
use कर रहे हैं as
Right.
a instead of a contraception, that is very harmful for health, and
Hmm.
it can cause a lot of hormonal disturbances
Correct.
and periods काफी irregular and काफी issues हो
Yeah, it
सकते
can
हैं.
affect few months after that, in fact,
Few
so
months. Yeah. I think that actually, something that मैंने देखा है कि a lot of women आपको लगता है कि मतलब it's my partner doesn't want to use a condom,
hmm.
and so I'm taking all this, but seriously the amount of harm that can come to women because you're taking these hormones
Correct.
is much. It's like 1,000 times more than the slight
Discomfort.
difficulty that your partner
Yeah.
has to go through to wear a condom. Condom barrier method होता है, उसमें hormones नहीं होते हैं. Really, anything from 1 rupee to a couple of 100 rupees cost करता है. It's so
Yeah,
easily
and there are
available,
so
and it,
many like super thin ones available, so the trial and
yeah,
error is a method to find the condom of convenience, and it has the additional benefit of protecting you from sexually transmitted infections, especially if you have multiple partners, your partner has multiple partners. You don't know what you are being exposed to, and the eye pill or even the contraceptive pills don't protect you from a sexually transmitted infection. So it's best to use a condom in such situations to like protect yourself, safeguard yourself against a lot of these sexually transmitted infections are not curable. You are stuck with them for life, so using a
yeah.
condom is extremely important.
Yeah, just one thing I wanted to say is someone is
Yeah.
facing Tanya, आपको जो incontinence की issue है after C-section, we need your reports, we need a lot of information. Instagram live में शायद will not be able to, doctor will
Yeah.
not be able to answer your issue, but on Pinky Promise app, please book a consultation with Dr. Reema. She is available, उनके slots है, and बाकी हमारे doctors भी बहुत amazing है. We
Right.
handpick very good doctors, okay? We will be able to support you, but we require a lot of information, and so
Yeah,
we need to
some
have a
communication,
consultation.
that's right.
Private consultation is required. So please come to our app and book a consultation. We'll be able to help you. If you have any problems, हमारे Instagram में DM करो. We will be able to tell you the right link. Okay. But I think, Dr. Reema, back to the issue of condom use and contraception, I think that
Yeah.
people say, "Oh, I love you. I don't want to use this condom."
Hmm.
It's all this is nonsense. If your partner loves you, they will love you and will make sure that you feel safe and protected, and your health is prioritized. So remember
Yeah.
that. Remember that your health is important. Your long-term
You need to
fertility
love
is
yourself
important.
also first, and take care of
Exactly.
yourself. Stand up for yourself and say, condom is for my protection as well. I need to stay safe from these conditions. You may not have any partners right now, but we don't know what kind of an infection may have been in your system before. Sexually transmitted infections can survive for a long time within the system. A lot
Yeah.
of them are blood infections that don't go away at all. So stand up for yourself first, love yourself first, and ask for a condom right away.
So next topic you have really led into it, Dr. Reema. आप हमें STIs के बारे में बता सकते हैं? Like what are these sexually transmitted infections? I feel like जब when as kids used to be really scared, used to be
Right.
like STI हो सकता है, and we had no idea like
Yeah.
क्यों होता है, क्या होता है,
Correct.
इसका क्या symptom है, what do you have to watch out for, test कब करना चाहिए, कौन जिसमें है, कोई आइडिया नहीं है, right? It's
Right.
like आप सेक्स करोगे तो STI हो
Yeah.
सकता है, but
Right.
can you tell us a little bit more about STI?
Right. So STIs are like two types. Some of them are temporary and curable. Some of them are like long lasting and remain within your system. So they are usually transmitted by penetrative sexual intercourse, but also maybe transmitted through like oral sex and things like that. So either cases, it's best to use barrier contraception to protect against them. If you have had multiple partners, if your partner has had multiple partners, it's best to get tested before you go into a sexual relationship.
Yeah.
It is possible that if you have just started, it may take some time to show up in your results. So the timing is also important. It's best to talk to a doctor, discuss your sexual history, and then go ahead and book your sexual STI test. And the ones that are treatable are very easily treatable. You need basic antibiotics. You do not even need hospital admission. You can completely take a prescription and carry on the treatment. HPV is a common STI which is preventable. So if you are sexually active, or if you're going to be, if you are going to be, you can take a vaccine beforehand. If you are sexually active, it's best to get regular pap smears done at your gynecologist clinic, and very easily you can prevent the harmful effects of HPV infection, which can lead to cervical cancer.
Okay. So basically, in obviously STI जैसे बाकी सारी चीजें हैं, it is not a death spell. Prevention is
Right,
better than cure.
right,
And हम easily prevent कर सकते हैं if you are getting tested regularly. And
correct.
अगर आपको लगता है कि you are at risk और आपका exposure हुआ है, talk to one of our gynecologists at Pinky Promise. No judgment, yeah. Like we
Yeah,
understand these things happen.
absolutely.
Um, so really, like we'll be able to help you out, honestly. So if you're worried,
Yeah,
stop googling it,
yeah,
stop freaking out about it. Come to Pinky Promise. But certain STIs are only manageable and treatable and not curable. So you have
yeah.
HIV and I think herpes, if I'm not
Hep,
mistaken,
yeah,
right?
Hep B, hepatitis B also, herpes.
Hepatitis B,
Yeah,
yeah, hepatitis B, yeah, hepatitis B, of course.
right.
And so it's important to actually focus on ensuring that your risk is
Prevention.
low
Yeah,
and prevention is use a condom. Number
yeah,
one. Number two
yeah,
is get tested regularly,
yeah.
especially if
HPV
you have multiple sex
vaccine and pap smear, right? And
Pap smear,
STI
correct.
test.
हाँ,
Yes.
Pap smear कौन से एज के बाद करना चाहिए रेगुलरली और कितना रेगुलरली करना चाहिए?
Right. So mostly if you are sexually active, once a year is recommended. After 3 years of like normal pap smear, you can do it like once in 2 years. So
Also, by the way, one of our doctors, Dr. Pooja Jain, is also joined. She is
hi
amazing.
Pooja.
Um, so I hope we are doing justice to the
Yes.
questions.
Feedback is welcome.
But I think the last question that I have another question, right? ये HPV के बारे में
Yeah.
अभी actually बहुत ज़्यादा awareness हो गया है. A lot of people are asking us about cervical cancer vaccines and everything, Dr. Reema.
Right.
So I think the issue honestly अभी बहुत expensive है. cervical cancer के vaccines, लेकिन Serum Institute is actually coming out with a very affordable version as well of cervical cancer
Right.
vaccines. And what I think people don't realize is two things, right? Number one is the age and the prevalence of HPV. So
Yeah.
can you tell us कि मतलब कौन से उम्र से हमें चालू करना चाहिए? Like at what point should you actually think of getting vaccinated? And now, like if someone is in their 30s or 40s or something, then how can they approach it? And I
Right.
think the second thing is if you can tell us how frequent is HPV, how
Yes.
prevalent is it? We want to know.
Right.
Yeah.
So HPV is the second, like cervical cancer caused by HPV is the second most common cancer in the world and the top most cancer of women in India. So,
Yeah.
and it is completely preventable. The recommendation for HPV vaccine, according to the guidelines, is the age group of 9 to 14 because there is very low exposure rate at that time. But it can
Yeah.
also be taken by slightly older girls if they haven't had any exposure, if they aren't sexually active. It is still a best option to take it rather than say, oh, the age is gone. If you have already been sexually active, the vaccine is still okay, but you may have been exposed, so it's best to go ahead and start doing pap smears to check for any growth, any possibility. I
Okay.
hope I've answered all the questions. Have I missed?
Yeah, I think you know what really blew my mind is जब मैंने statistics
Yeah.
देखा तो मुझे समझ में आया कि इंडिया में
Yeah.
93% of cervical cancers are actually
Yeah.
preventable और have an excellent prognosis. मतलब अगर आपको पता चल
And,
गया कि
and
cervical cancer है
yeah,
और आपने जल्दी डिटेक्ट कर लिया तो
you
डेफिनेटली
can
विद द राइट स्टेप्स हम
you can have
उनका हल कर
better
सकते हैं.
progress. Yes.
लेकिन इंडिया में क्या होता है हमें अवेयरनेस नहीं रहता है या वैक्सीनेशन नहीं होते हैं तो बाय द टाइम वो डिटेक्ट हो जाता है इट्स टू लेट एंड सो आई थिंक 1 in 5 ग्लोबल सर्विकल कैंसर डेथ्स इंडिया से होता है बिकॉज
Yeah.
ऑफ दिस
1 in 5. Yeah.
एंड
Correct.
it's very सैड कि ऐसा रियलिटी है बट द ट्रूथ इज इसमें
For,
वैक्सीन है तो
yeah. For
वैक्सीन
something
लीजिए लाइक
preventable. Correct.
if you're a mother, your son and your daughter can get
Correct.
vaccinated, by the way. It's not
Yes.
just something that
Yeah. So I
affects
get
women.
yeah. Yeah.
Yeah, I
Absolutely.
think that's what I
Yes.
realized. Like I have a son,
Son.
but
Yes.
I'm gonna vaccinate him for
Correct.
cervical cancer as
Correct.
well
Correct.
as
Yeah.
my daughter.
Yeah.
Right?
HPV
So it
virus. It is basically so it can cause cervical, penile, all kinds of cancers. So most common
correct
is definitely cervical. But yes, vaccination can be done for both sexes.
for both.
Absolutely.
I think as if you're a parent, vaccinate your children early. Talk to your pediatrician, उनसे बात करो, बोलो HPV वैक्सीन के बारे में आप मुझे बताइए, so that pediatrician आपको बता सकते हैं. So getting vaccinated for your kids is important. And if you are an older lady, then talk to your doctor and see if a vaccination is applicable to
To
you
you,
because it
correct.
will be based on your sexual
Correct.
activity. And if
Or
it
a
is not
vaccine.
applicable,
Yeah.
pap smears करना बहुत important है. Also, one thing I've learned which I did not know actually was that अगर आपने vaccinate भी किया, you still have to get your pap
Yeah.
smears done.
Yeah, true
Yeah,
that, true that. So HPV is
yeah,
just one of the causes of cervical cancer. So, and the preventable one. So you still
yeah.
need to get an examination frequently and get the pap smears done to avoid cervical cancer. Definitely.
Yeah, this is something that I realized. So I actually got HPV vaccine when I was in
Got it.
college. मेरे college में वो लोग
Oh,
दे रहे
okay.
थे US में.
Right.
And
Right.
so I was like, I'm done. I have to take the vaccine and then
Yeah, you
I'm
took
put
it.
another.
Yes, it's still not. Yeah, unfortunately, we have that is how our bodies. We need to keep getting these examinations and tests done. So true that.
Um,
Absolutely.
So I'll switch gears a little bit to our last
Right.
question. And we're getting quite a bit actually streaming in.
Okay.
Loads of people actually asking us, oh, okay. There's a lots of questions, but I think I'll choose one topic. And the topic that we have gotten a lot of questions about, even at Pinky Promise, is a bit of a controversial topic, but it's to do with sex toys, right, Dr. Reema? I think
Right.
a lot of people now, there are a lot of good brands also that are publicizing the usage of sex toys. But there's a lot of misconceptions and a lot of confusion about the right safety and the right things associated with
Yeah.
it. As a gynecologist, what would be your advice to women who come and ask you these questions?
Correct. So the first and foremost thing I have come across, Divya, with women using sex toys is frequent vaginal infections. So maintaining hygiene, storing it properly, cleaning it before and after use, making sure if there has been, a different kind of a use, then you are using the appropriate method of hygiene. There are different materials that are used to make the sex toys. There's rubber, there's silicone, there's glass, there's etc. So every material has its own different way of cleaning to remove the infection, and storing it in a proper container or a bag when you are keeping it away is very, very important. Also, apart from that is injury during, while using a sex toy. So if you are not comfortable, please read instructions, please use the appropriate size, please use lubrication if required. Think about your hygiene and health first. If your partner is using it, insisting on using it, talk, communicate, allow for comfort zone, while using it, just not because it's the cool thing to do or it's the new thing to do. Make sure that you are using it correctly and comfortably for yourself.
Yeah, yeah, yeah. No, that's very, very useful advice. I think people also don't realize that there are different toys that go to different places.
Correct,
Um,
correct.
so there
Yeah,
are
yeah. Right,
so there are toys for clitoral stimulation, which need to be like the massagers and stuff, and then you have toys for penetrative intercourse.
correct.
So basically, it's important to realize what does what,
Yeah,
and not sort of use
right.
everything,
Yeah. And
because
if they
it's
have
also
batteries or electrical supply, then, be careful
be
using
very
that and washing it with, remove the batteries and use a cloth to wipe it down. Don't wash it, like don't dunk it in water and things like that. So,
exactly,
yeah,
exactly.
read the instructions carefully. Yeah.
Yeah, please read the instructions carefully. And if you're not comfortable with using these toys and one of your partners is interested in doing it, please make sure you communicate,
Correct.
take it slowly,
Correct.
uh, educate yourself first because nothing is worth rushing into. And so it's very important for you to prioritize your health, your education. And if you have these kind of questions and you're not sure who to ask, Pinky Promise is there for you. We are available 24/7 and we're here to answer these kind of questions because we know that you're not, there are very like all sorts of information out there. So get information from a doctor properly, come and ask us. And in
Yeah.
fact, there are a lot of women who actually
Yeah.
book consultations with
Yeah.
Dr. Reema and others to ask these questions. And kudos
Correct.
to you because that's awesome. I really love that today we are so empowered and we're doing all these things. And I think, Dr. Reema, that brings me to the end of my questions. There are a few questions that I have not answered. एक तो question है कि क्या sex की वजह से UTI हो सकता
Right.
है? And there are a few people who have discharge problems.
Yeah.
So people who have discharge issues, I just wanted to say something that Dr. Reema ने आपको, we cannot in a live session give you
Answer treatment
customized.
questions. Yeah.
Yeah, like we need personal time with you
Yeah.
to understand what's going on. It's a
Absolutely.
little bit of a fact-finding mission to diagnose
Right.
people.
Yeah, and
So
you may
come
need
to our
different
app.
medicines for different things, so it's best to do it
Exactly.
personally rather than on a live.
Absolutely.
Absolutely.
So come to our app so we can actually take care of you and help you sort the problem.
Right.
Um,
For
and
the
it's
UTI
instrument for,
question,
yeah,
I
तो
would,
sex की वजह से क्या UTI हो
yeah.
सकता है? Do you have a answer for that?
Right, right, absolutely. So the female urethra is actually very short, and it's possible to get a UTI if you have been recently sexually active. It's best to pass urine before and after sexual intercourse and wash yourself down or wipe yourself down. And if there is any humidity, wetness, then
Yeah.
pat dry with a toilet paper and. Make sure you're well hydrated, so that definitely washes out any infection that may have gotten into the urethra during sexual intercourse.
Yeah. Yeah, no, thank you so much. I think that's very helpful. Like, I think peeing after sex helps a lot.
Correct.
Making sure that there is proper hygiene before that. So the
Correct.
penis owner,
Yeah.
actually the thing is that वो
That's
जो
it. Back.
bacteria है, I think it's E. coli, right? Which is the most common reason for
Yeah.
UTI, if I'm not mistaken.
Yeah, but not during like sexual intercourse. So E. coli
Okay.
can be like any time, but yeah,
Okay.
definitely E. coli is one of the
Okay.
most common bacteria that
Okay.
causes
Okay.
confusion.
Yeah, because I was saying like wiping from front to back, not from
Yeah,
back to
back
front,
to front. Yes,
prevents the
so
bacteria from the
from
anal
going
region from
fecal,
coming.
yeah,
Yeah.
fecal bacteria. E. coli is the most common fecal bacteria, so that definitely
Correct.
front to back is the best way to do it. Right.
Yeah, but I think drinking adequate water, peeing after sex, making sure that you wipe yourself down properly, all that are good prevention tips. And if you end up getting a UTI, don't ignore
Yeah.
it. Talk to a gynecologist so that they can give you the right medicines for it,
Right.
right? And Dr. Reema and all the others on our platform, even Dr. Pooja who joined us today, they are all like, very experienced, right? These are things, these are the kind of questions that they are able to see on a daily basis. So अगर आपको लगता है कि यार मेरे साथ ये हुआ है, like is this normal, is it not normal? Trust me, whatever you're going through is normal. Thousands of people have gone through it, and they are there to support you for it. And I think with that being said, Dr. Reema, thank you for all the work that you do, for all the patients at Pinky Promise, and how much you support people. Thank you
My
for all
pleasure.
our doctors who are always there for us, doing such incredible things. We are done with our live session for today, but hopefully ये जो video है,
Yes.
it will remain, it will be posted, it will be shared. Thank you for everyone who's joined in and asked their questions. I hope ये आपके लिए useful था. I hope that this has helped you take care of yourself a little bit. And every Wednesday we're going to be doing this. So join in, ask
Thank you. Yes.
questions, and get to know us better. Thank you.
Thank
Thank you, Dr. Reema, for your
you.
time.
Thank
I
you,
know you
Divya.
have your consultations to go back to, so we will not hold you anymore.
Thank you. Thank you. Take
Thank
care.
you. Bye bye.